condition if you have thyroid, which millions of people in the world have it. So we are going to be talking with Stiana. Stiana is a functional medicine nutritionist. She has helped thousands of her clients with diagnosis of thyroid condition, and also helping them manage it with nutrition. She is joining us from UK. Welcome, Stiana.
Thank you, Amita, and it's so lovely to join you today. So thank you for inviting me to come on and speak about diagnosing thyroid conditions and why I really believe that we're failing millions of people around the world because our current system doesn't provide the accurate markers for testing. So yeah, thank you for having me.
Sure. So yeah, you talk about why the current thyroid testing model is failing. So let's just talk about, I think what you're trying to say is like a lot of people go undiagnosed, right? The way you've said it in your slide, right?
Absolutely. So it's estimated that around 1 in 8 women will develop a thyroid condition in their lifetime. But the sad thing is that a large number of women will not know that they have a thyroid condition. And I myself was one of those individuals. Like, I didn't know I had Hashimotos, and it wasn't until 5 years after falling really, really ill that I, through my own quest to find out what was going on with my body, once I got better, I was able to go and study naturopathic nutrition. And it was in my second year of studying that I actually realized that we hadn't tested all the thyroid markers. And when I ran a private lab test, I found out that I had Hashimotos. Obviously, since then, I've made it my mission to work with women like myself to try and empower them to understand that we can actually take matters in our own hands and get the accurate testing done. And it's just knowledge is power. And so now I'm in a position to help, women around the world to get the right testing done, and also hopefully establish that what's going on with them, because there's so many women who are just not aware. They're dealing with these symptoms on a daily basis, and their doctors is telling them that their blood results are normal, and they might well be normal, like mine was, and mine is still normal, but yet my antibodies was off the, was off the ground, massively elevated. And that was already 5 years after I'd started doing very specific functional work, to using functional lab tests, doing a lot of gut work, doing work to help modulate my immune system. I was no longer in bed, no longer requiring a wheelchair. And I was actually a lot better by that point, but I was still, my antibodies were still massively elevated at that point.
Okay. You talk about the secondary and tertiary hypothyroidism. What is that?
So there's different types of thyroid, different types of thyroid disease, if we want to call it that. So the word disease basically just means that things don't work in the way that they really should work. And when we look at the thyroid, there's different forms of disease. So primary basically means that it's either Hashimoto's, so it's where there's autoimmune antibodies against the thyroid, or it's just hypothyroidism, where we have where the thyroid is not producing sufficient thyroid hormones, so thyroxine and triiodothyronine, which we'll go into in a little bit. But secondary and tertiary. Secondary is more to do with the pituitary gland not producing thyroid stimulating hormone. And then you've got tertiary, which is more to do with thyrotropin releasing hormone. So it's more about the communication that's happening between the pituitary and the thyroid than the thyroid itself. And actually, it's a really small percentage of people that struggle with secondary and tertiary, but I do see it. And I think, 99% of the cases are predominantly primary, and a large number of those are actually Hashimoto's. So Hashimoto's disease, actually, I think very often people refer to autoimmune disease as something where the body's turning on itself. And actually, as someone who lives with Hashimoto's and work with other women and men with autoimmune disease, actually, I don't believe that that is the theory for autoimmune disease. I genuinely don't think our body will ever turn on itself. It's very much a protective measure where the body is dealing with cell danger or something bigger going on, and it's a protective measure of trying to protect the body, and the immune system is kind of reacting, but quite severely at the initial outset when autoimmunity develops. So in the case of the thyroid, there might be some serious cell danger going on somewhere whether that is an infection in the gut, mold, vitamin D deficiency, whether it is selenium deficiency, whether there is some heavy metal toxicity, whether there is a genetic probability as well. But the immune system will then infiltrate the thyroid gland, and slowly, because there are so many lymphocytes going into the thyroid gland, it will slowly start to destroy the thyroid gland. And that's what we call Hashimoto's or autoimmune disease. So there are two different types of autoimmune disease. You get Hashimoto's, which is where the thyroid is not producing sufficient levels of thyroid hormone. And then you get Graves' disease, where the thyroid is producing too much thyroid hormone. So for today's purpose, we're just going to focus on the thyroid not producing enough hormone. So hypothyroidism and Hashimoto's. So another trigger that can set off Hashimoto's disease is also hormonal changes. And this is this is how I developed Hashimoto's. So I developed Hashimoto's after the birth of our second child. And obviously no one pre-warns you that pregnancy might be a trigger for you to actually develop a thyroid condition, but it's really common. Like, we see a significant percentage of women who develop hyperthyroidism and also Hashimoto's after pregnancy. And that's because we see that immune shift between Th1 and Th2 during pregnancy. And that can trigger the onset going into that Th1 dominance. We can see that the onset of Hashimoto's. And the same can be said for hormones for females going into menopause, because as we see that shift in hormones as they reduce, again, that can lead to, it's a significant stress to the body, and that can also lead to the onset of Hashimoto's. So just for everyone who's watching, just a quick overview of what the thyroid is. So the thyroid is your butterfly gland, and it's basically just located in the base of the neck. And it produces three hormones. So the most well-known hormone that people all know about is thyroxine, which is T4, and it produces around 80% of thyroxine. And then it also produces triiodothyronine, which is T3, and around 20% of your T3 is produced by the thyroid. And then it also produces calcitonin, which is basically the hormone that helps to regulate calcium and potassium, but it makes sure that there isn't too much calcium in the blood. So your thyroid actually plays a significant role in terms of its function and what it does. So it's not surprising when your thyroid is not working properly, when there is disease, that you're going to have a whole range of symptoms that's going to go on with you. Like, you're going to feel pretty rubbish, because actually it's your master regulator for your metabolism. So it's kind of regulating your metabolism. It's also regulating your temperature. And obviously part of that means it's going to be regulating your breathing, your heart rate, your central, your peripheral nervous system. It's also going to be having a massive impact on your hormones. For us as women, which is why we're so much more prone than men, it's estimated that we're 8 to 9 times more prone to develop hyperthyroidism than men, is because our hormones are so closely connected to our thyroid hormone. So it can impact your menstrual cycle, it can cause infertility, it can impact your cholesterol levels, it can impact growth, especially when it happens, in childhood. So your thyroid hormone, there's every single cell in the body has got thyroid hormone receptor. So when there isn't sufficient levels of thyroid hormone in the body, it's going to impact everything that's going on in your body. So typically, if I see a woman coming to me with symptoms of a thyroid condition, I would be looking at, she would be presenting with feeling constantly fatigued, really kind of lost herself, like she doesn't recognize herself anymore. She kind of, she's lost her spark. She doesn't really feel vitalized and awake when she wakes up in the morning. She's got muscle ache or joint ache. She feels that her brain function is deteriorated. So where she could remember things in the past, she's struggling to remember things. She might get kind of lost for words, like mid-sentence. And she might find that actually she's a lot more irritable, and she's having hair loss, or she's got irregular periods, or she's got a very common symptom is bloating, really severe bloating, like being 3 months pregnant and really not understanding what's going on with that, because your thyroid is regulating your metabolism. everything is slowed down. And we also know that the gut microbes in your gut is responsible for converting some of your thyroid hormones. So we see that if there's an imbalance there, which can cause bloating, that can have a direct impact on our thyroid hormone. There are so many other symptoms that you can present with, but some of the most common ones are weight gain for no apparent reason, cold extremities, difficulty regulating your temperature. And personally, for me, I had extreme palpitations and panic attacks at the outset, and really, really cold feet and severe fatigue. So, it can really, really fluctuate. But I think the message I want to give across is that even although we have this massive range of symptoms, a lot of these symptoms will overlap with other conditions. So we might see people presenting with these symptoms who also have fibromyalgia, ME, or chronic fatigue, mole disease or infection, and they might have Lyme's disease. So it's very difficult sometimes to identify, well, what's going wrong with this person. And that's why testing is so incredibly important, because if we don't get the testing right at the outset, then we're not going to give the right support to people. So as in my case, and as I see so frequently with the clients that I work with, they've gone to their doctors, their bloods have come back normal, and they still don't know what's going on. They've been going to their doctors with symptoms for months, going, I'm feeling tired, I really don't know what's going on, I'm not myself. All these symptoms are going on, and yet their bloods are normal. So when we look at the standard blood tests that are run by most of the doctors, it is literally only looking at 2 key markers for your thyroid. And they're really important markers. So it makes perfect sense that these 2 markers form the foundation of our current blood tests. But unfortunately, this doesn't give us enough of an overview or picture of what's really going on with the thyroid. So the current markers that's being tested is thyroid stimulating hormone, TSH, and also free T4. So if you just go back up one slide, Amita, just to the original slide. Yeah. So you can see there that actually the reference range for TSH is up to 5. And in my experience, it's a bit of a postcode lottery, really. It depends on the doctor you're seeing, where you live, which country you're in. And some doctors might let that reference go up to 7. Some might actually want to put you on levothyroxine if you're on 2.5. But from a functional medicine perspective, we really don't want your levels any higher than 2, 2.5. But having said that, thyroid stimulating hormone is a very individual, and some people can feel really good when their levels are at 3 or 4. So again, we never ever treat the test results. We always treat the person and work off the symptoms that the person's presenting with. But these current markers, what they're telling us is what is happening in terms of the communication from the pituitary to the thyroid. It's a negative feedback loop. So basically, when your body doesn't have enough thyroid hormone, what will happen is your master traffic controller, your hypothalamus, will signal the pituitary to make thyroid stimulating hormone, because thyroid stimulating hormone is the hormone of the pituitary gland. And then once that will then stimulate the thyroid to make thyroxine, which is what we're looking at here, free T4. So most of the thyroid hormone is bound to protein, and what we want to look at is what is free in the blood. So when it goes into the tissue, we'll be able to see what's actually making it into the tissue, because that will become free. When it's traveling in the blood, it's going to be bound to a protein. So again, this reference range here is really far from optimal. And my reference, for example, was 8 all the time, 8, 8.5, 7.5. And it was never picked up as subclinical thyroid, hypothyroidism or primary at any point. If we look at the functional lab test markers, which is the next slide, Amita, you can see that it's much more comprehensive, and we're getting a really, really good overview of what's going on with the thyroid. So we're not just looking to see, is the pituitary getting the instructions that there's not enough thyroid hormone? Because if it is, the TSH will be really elevated, because it will be communicating to the thyroid to make more thyroid hormone. And then also how much thyroid hormone is making it into the cell. But the key bit to stress here is that thyroxine, T4, is actually only the inactive thyroid hormone. And in order for your body to have thyroid hormone available, it needs to be activated. Like most of the things in our body that requires enzymes to activate things and get it into its active form, the thyroid hormone is no different here. And again, we need certain enzymes known as deiodinases to actually help us convert T4 to T3. Now, your body actually makes around 30 micrograms of T3 in one day, and as an estimate. And so actually, when we look at how much your thyroid's producing, it's only actually producing around 5 micrograms of that. And then 5 micrograms is down to deiodinase 1, which is the conversion that's happening in the kidneys and the liver. And then 20 micrograms is actually coming from your tissues. So this is your tissues in the body and that conversion that's happening at the tissue level. And so if we don't have the right nutrients in our diets, then it's going to massively impact how well we're converting that T4 to T3. So when you're dealing with someone who's fatigued, gaining weight, they're losing their brain function, their memory, they can't really, and they feel irritable, they have low mood, their hair's falling out, it is because potentially they don't actually have sufficient levels of T3 in the body because their body is not converting T4 to T3 optimally. And so whilst it's great to be giving someone medication to support and supplement T4, which is our current medical model in the way that we treat hypothyroidism, it's not going to be addressing the root cause of the problem. And this is why doing a functional lab test is so, so important, because we're actually wanting to see how much T3 this person has available. And also, is that conversion taking place? And more importantly, is there any autoimmune antibodies? So there are 2 standard autoimmune antibodies that we can run on the current sort of finger prick lab test. It's available in most places, which is going to be determining Hashimotos. There is also thyroid stimulating antibodies, which will be looking at Graves, but that has to be a very specific lab test that we'd have to request. And there are also something else that you can add to this lab test known as reverse T3. And I mean, I don't know how much time we've got to go into this, but I think sometimes in some individuals, that's a really, really important marker to run, because reverse T3 is basically your body's way of kind of, again, converting some of the T3 to make it inactive. Because remember, your thyroid is only working to kind of make sure that you have enough thyroid hormone. If there is something going on in the body at a cellular level or in the gut or the immune system that's creating that cell danger response and causes a stress to the body, then what would happen is the body would automatically say, well, maybe we don't need more T3. Let's shunt it away to reverse T3 because there's a stress going on here. And very often this reverse T3 can be a massive indication for us that the body is not tolerating stress very well. So sometimes I do think this is a really important marker to run that, again, you will not get your GP to do. And you know, it can really add significant value into you understanding, one, what's going on with your thyroid health. Secondly, if you're on thyroid medication, are you actually being medicated properly? Because sometimes you can be over-medicated and the body will just shunt the T3 away. And this is especially true if you're on T3 medication. And I don't think that this is currently being done by any doctor to check what's happening with that communication in the body. So for me, these are simple tests. They're not expensive. And you could run this yourself to see what's actually going on with the thyroid. So Meet, if you move to the next slide, yeah, that just gives the other 2 markers that I think they're additional markers. They don't generally form the basis for what we can buy privately today, unless you get specific tests which are done via a blood draw and not a finger prick. Then these markers can be included in that test. So I think definitely you can see that. I mean, one thing I didn't cover is that in functional medicine, we're really looking at functional levels of blood, right? We're not looking, when your GP is running a panel and they're telling you your bloods are normal, they're normal because they're looking at your markers are an average of a sick population. when we're looking at functional markers, we're really looking to see what is your what is your optimal health? What should your optimal health be? And those reference ranges is really what we're interested in. How can we get you up to an optimal level? So T4, for example, you know, we were looking before that the lower level was 7 and the upper level was 17. You know, these will fluctuate depending on which practice and doctor you see. But actually, from a functional medicine perspective, optimal levels start at 17. So you can see there's a real disparity there in terms of what the reference ranges alone should be. And this is why working with a functional medicine practitioner is really valuable, because you'll get that insight into what you're aiming for. So I think the big thing really that I just want to stress, I mean, we can go into the detail of the markers, but really the big thing is, by just looking at thyroid stimulating hormone, you're only factoring in what your pituitary hormone is doing. By missing out your T3 and your antibodies, you're missing a really important part of what's potentially going on with your thyroid. And I think that for the cost of doing a private test, I think this is something every woman should do annually as an MOT, because I think you'll be able to come from a place of prevention, but definitely also potentially come from a place of diagnosis to understand what's really going on with your symptoms. So for me, if you've got any questions around, you know, going into pregnancy, or you want to conceive, or you're heading into menopause, or, you know, you've had your child and 6 months later you're not feeling great, or 12 months later, then definitely run a panel. If you've got a genetic history there, definitely get the panel done. I think also, if we look at the current diagnosis, which is on the next slide, Amita, again, it is really, you've got clinical hyperthyroidism, which has to have an elevated TSH, and that reference range, as I said, is really a postcode lottery. So some doctors might have that at 3, other doctors will have that up at 7. So it really depends on who you're seeing. But if that's elevated combined with a reduced thyroxine, T4, then that means that you've got clinical hypothyroidism. Subclinical is where you've only got a raised TSH and your T4 is normal. But again, if the reference ranges are so out of place, so many people are going to be missed off, and we still don't know what's happening with their T3. And as in my case and many of the clients that I see, I have clients who come to me with lichen sclerosis or eczema or psoriasis or real severe SIBO. And when we run their thyroid panel, they have Hashimotos. So these women would never have known that there was a problem with their thyroid had we not run that. And then, of course, the way in which we approach it is so distinctly different to how we would have done it if they had you know, just an underactive thyroid. So that brings us onto the point of treatment options. At the moment, the only treatment option that's out there is either having T4 replacement or the combination of T4 and T3. And that's, generally speaking, if you're adding T3 in the UK, it's done through your endocrinologist. Your GP will very rarely add in T3. But again, if you have Hashimotos, then this is really not the way to go about supporting your thyroid, because the problem isn't so much that your body isn't producing enough thyroid hormone, it's that your thyroid is being infiltrated by immune cells that's trying to protect you. And so again, the way in which we would support Hashimoto's is very different. We want to understand what's the root cause for it. So just to quickly recap on that, why are so many people not being diagnosed? Firstly, it can actually take up to 10 years for disease to be visible in your blood. So, you know, you could be feeling really unwell for a long time before that blood marker is showing that there's a problem. And then also, as I've mentioned, insufficient testing, because we're only looking at those 2 markers, and a large percentage of people have Hashimoto's disease. So unless you're testing antibodies, you're not going to know that. And then also dealing with people who are going through pregnancy and giving them the right education prior to going in, and making sure that these women are empowered and educated to test their thyroid properly 6 to 12 months postpartum, because we can still see a significant fluctuation in thyroid numbers in that first 6 months. And then also, again, as I mentioned earlier, you know, going into menopause, and moving away from micromanaging symptoms, but trying to understand what's at the root of the problem. And, I think it's important that we understand that, very often I have so many people who speak to me about the fact that they've been told they've got thyroid cancer, and it's actually a good cancer to have. But, having an underactive thyroid and having Hashimoto's can have significant consequences on your long-term health. And if it's not being supported in the right way, it can definitely impact your lifespan, your quality of life, significantly. We know there's a very strong correlation with cardiovascular disease. Definitely, we're seeing a significant increase in terms of endothelial function, but also in terms of arrhythmias. Because, as I said earlier, your thyroid is regulating your metabolism, and we can see typically people with slower heart rates. We can also see people with palpitations and that fluctuation between it. And I think what happens in Hashimoto's is we see that there's damage to the endothelial, which can impact what happens in terms of the outcomes for cardiovascular disease. There's also the risk of infertility because it has a direct impact on our hormones. And we can just do a live presentation on just thyroid and sex hormones, which is significant correlation there. And then also dementia, which fortunately, if addressed properly, can be reversed. And then also things like small fiber, sensory neuropathy, and there's an increase for a second autoimmune condition. Once you've got one autoimmune condition, your chances of developing a second autoimmune condition significantly increases. So it's not something that you don't want to, you want to make sure you get the right testing and support so that you get the right, information to your thyroid so that it can work properly. So who's at greater risk for developing an underactive thyroid or Hashimoto's? Well, firstly, if there's any family history of a thyroid disease, that's really important that you're very vigilant in getting your thyroid tested. We know that especially from mothers to daughters, that link is really strong. Again, if you've got any other autoimmune condition like type 1 diabetes, RA, anything else, lupus, Sjogren's, it's important to do that. And then again, if you've been previously treated with radioactive iodine. So we've not really dived into iodine. Again, that's a big topic in itself. We know that people can become hypothyroid if they don't have sufficient levels of iodine, because your thyroid is the only hormone in the body that requires iodine, but it also makes iodine. So if we have too much iodine going into the body, it can actually damage the thyroid. But if we don't have enough, it can also damage the thyroid. So it's a little bit of a double-edged sword. But, we know that radioactive iodine is definitely a precursor for developing hyperthyroidism, Hashimoto's. And then being female, one of our wonderful things, our hormones definitely give us lots of joy and definitely many risk factors that come with that. So I think with Hashimoto's in particular, the typical age for that is around 50. So women over the age of 50 are at greater risk of developing Hashimoto's. And then, as I mentioned earlier, postpartum pregnancy and then menopause as well. So these are all things that if you know that this is potential risk factors, that you can be specifically taking action. So what do? First of all, you get a functional lab test. You're in the UK. These tests can vary anywhere from £79 to 120, depending on how comprehensive they are. But for me, that's a really small price to pay to get a really good insight into what's going on with your thyroid. Secondly, you need to assess the results. What's actually going on and what's the real problem? Is it that your thyroid is not producing enough T4, or is it a problem with the conversion to T3? Or is there a problem with your antibodies, and is it more an immune-related thing? Either way, it needs to get the right support at the outset. And then you need to figure out, well, actually, what is the root cause of all of that? So that's step number 3, is identify what's the root cause. Because your thyroid is only, as I said at the outset, this disease is a byproduct of your thyroid trying to protect you. It's your thyroid going, there's some cell danger going in my body, what's going on? And its response to that is to either reduce the amount of thyroid hormone being produced or antibodies, in white blood cells infiltrating the thyroid gland. So you've got to figure out what's your root cause. And then it's really about going down many rabbit holes, as very often the case in Hashimotos, of actually addressing the root cause. And that's not always that straightforward, to be honest. So when we look at the next slide, Amita, you can see here that the common root, and I've only put a few things on you. This slide could have been so much busier. But really, when we look at the bottom end and we're looking at particular root causes here, there are many, many root causes connected to hyperthyroidism and Hashimoto's. The gut is a really common root cause. Leaky gut has always been known to be connected to autoimmunity. So has gluten. So has your diet that might be high in refined sugar, or a typical Western diet that's full of processed foods, and refined sugar and carbohydrates, not having enough nutrients in like selenium and zinc to support the conversion of T4 to T3, having excess estrogen, because we know that in itself directly impacts thyroid hormone and reduces it. Menopause, as I said, things like heavy metals, having loads of mercury fillings in your mouth, but also having the exposure of heavy metals in the water, the tap water that you're drinking. And then also, dealing with things like mold or in your environment, or maybe you've got issues with mineral deficiencies, or maybe like myself, you have parasites. I had 2 parasites and definitely had leaky gut, and I've got lots of mercury fillings, and the list can go on. There's lots and lots of different root causes, but you've got to try and figure out what's going on. And trauma is a significant root cause. Any adverse childhood events, or maybe smaller traumas, maybe it's just something like losing your job, or a close relative passing away, or a breakup with a loved one. Whatever that trauma is to you can have an impact on your thyroid. And then the symptoms associated with that, which we've already gone through, it's trying to understand how do we manage the symptoms, and then whilst addressing the root cause. So the way in which I work with my clients is very much a 360 degree, definitely more than 300 degrees, 360 degree solution to thyroid wellness. And this is where we're going so much deeper. We're really looking at all the different functional testing that we might need to use in order to understand what the root causes are. I don't think there's ever just one root cause. And then we're addressing the diet to make sure that the diet isn't full of foods that might be reactive to that individual. I'm a prime example of that. My diet's really clean, but I recently found out that I'm reacting and intolerant to things like oats, and to rice, and to pea, and to most nuts. So if those foods are driving my antibodies, then obviously that's making my condition so much worse. So it's understanding, obviously optimizing your diet, but are there specific foods that doesn't suit you as an individual? And then looking at that individual's lifestyle factors, are they engaging in things that's adding stress, that might be encouraging that reverse T3 pathway? And pulling the active T3 out of the body instead, because the body's trying to protect it because it's under stress. And then also what's in their environment, is there, again, mold in their environment, or heavy metals in their environment, or do they live in an environment with lots of stress, emotional stress because of abusive relationships, or whatever's going on. And then really, really important is mindset, because our thoughts have such a big impact on how our body functions. So it's really, as a neurolinguistic practitioner, we're tapping into what's going on with your thoughts and why it might be fueling that inflammation, adding, more gasoline to your fire that's making your thyroid, behave in this way, trying to protect you. And then obviously looking at movement as well, which for some individuals can be quite difficult, because it's that, they might feel that when they exercise, the backlash of that means that they feel fatigued for quite a couple of days after. So it's trying to understand that, it's about strength building and working on building muscle so that your thyroid can thrive rather than just survive. So that's basically the approach that I work with my clients. And I genuinely believe if we around the world all change how we look at things, and the things we look at will change, because continuing to look at thyroid disease by looking at 2 blood markers is not really going to give us a full picture of what's going on with that person's thyroid. And if we just change the way we look at that by looking at more markers on a different panel, then we can really see that actually what we look at is completely different to what we thought. So yeah, I'm really passionate about it, because I had so many years where I felt that my daughter was just born. I had precious years that I was so excited about enjoying, and sadly I couldn't really enjoy that with her, because I was in bed and I didn't get the right support, and countless trips to the doctor, and I just didn't get the answers I was hoping for. And I know how challenging that was for me. So, it's brilliant that we're fortunate today that we have so many labs at our fingertips just to get the right testing done. But I think it's just having the information. Like, so many people don't know that they can do this for themselves.
I think it's beautiful. I mean, I love the way you recited your story, and so much detail is needed, right, for the thyroid, which a lot of us don't even understand, and we end up going to our regular doctor, not to undermine anyone's capability here, but the normal things you look at is the blood test or the TCH, and you don't think about there'll be so many layers that you have to go deeper into it.
Absolutely. And the thing is, it's also understanding the physiology of the thyroid, because I think even for doctors, they're really just looking at the blood markers. They're just looking at the results. They're not working off the symptoms to go, well, actually, that is a thyroid problem. What am I missing? What's not happening here? And why is the thyroid behaving in this way? And rather than just throwing in T4 medication in many instances, and a lot of these women on T4 medication, they're not actually feeling any better. So that's the sad part, is that they might have a little bit of a wind, that happens in the first couple of weeks being on it, but then it just drops back to how they were feeling before, because it's not addressing the problem. And actually it might be compounding the problem and making it much worse. So yeah, it is, I think it's fascinating. And I think it's fascinating when we change our perspective of what the thyroid does and why it's doing this. And really, your body is always trying to do the best it can for you. So your body's not turning on you. It's not making you suffer. It's not behaving in this way because it's not doing a good job. To the contrary, it's doing a great job. It's actually doing the work it's supposed to do. The only problem is whatever inflammation or pressure that's cooking in this pressure pot is not being addressed. So the thyroid is going, well, we've got to do all these things to protect the body because we've got to keep it safe. But actually, and then we're just putting a lot of T4 in or a lot of T3 in. And this poor person has still got a gut infection. They're dealing with mold. They've got massive viral load. And none of the problems are being addressed. And then they're just upping the medication. And the poor thyroid is going, oh, but there's even more we got to get rid of now. So
vicious cycle here.
Exactly. So it's really understanding that. And it's hard sometimes, I know how I felt when I didn't get the right support, and you just think, oh gosh, I just wish I had a different body, and I wish my body wouldn't behave like this. But actually your body's just doing its job really well. The problem is what's going on somewhere that you're not picking up. And if you address those things, then the body's going to go, oh, okay, we can do things normal again because you've removed that big danger. You've taken that away and it's no longer a threat, and actually I can produce thyroid hormone and I'm good. So it is, and it, of course, it gets hard as we get older. Our bodies don't, it doesn't work as smoothly. Things do go a bit slower. Our thyroid does work slower. Our body works slower. Our metabolism slows down. Things don't work as as well, but we can still do so much to support ourselves.
Absolutely.
If we're just willing to take the action. And it's about taking full responsibility for your own health, to know that you're the only person responsible for your health, not your doctor, not your partner, not the physician you're seeing or the endocrinologist you're working with, but you are. And you've got to take the actions to ensure that you're getting the right support.
I think amazing presentation, Stiana. Yes, we are just trying to empower all of you, including myself. I'm not a doctor, and I'm getting empowered every single day. But really, our goal is to empower the end user, to educate them, how they can take care of themselves through functional medicine. And there is so much more to it by understanding the root cause of what your problem could be.
Absolutely. And I think that is what we need. We live at an amazing time where information is at the click of your fingers. There are so many videos being live streamed, and you're doing an amazing job, Amita, spreading, creating awareness, sharing information and giving people the tools on how they can do things differently. Because, anyone can address their health, no matter what's going on, to some degree, through diet, through lifestyle, and through understanding where things went wrong in the first place, going upstream and trying to look at where things went wrong, which is why in functional medicine, we use a timeline. We want to understand where did things become, problematic for their body, what could have triggered things. But yes, I think it's brilliant what you're doing, and it's been so lovely to come on with you today. Thank you so much for inviting me.
Absolutely, you're welcome. Like I said earlier, we are just trying to increase the awareness. That we are on a mission to do that to all over the world. I wish we reached there, but that's why we invite experts from all over the world, and to really empower you as a user, to educate you, to take control of your body. With that, thank you so much, Stiana, for being with us. Thank you to all the viewers for supporting us every single day.
Oh, it's been a pleasure. Thank you so much for having me. And, I just want to say thank you for all the amazing work you're doing for spreading the awareness and empowering people, because I think we need, more people like yourself to do this on a daily basis and get this information out there. So thank you to you.
Absolutely. Thank you.
Thank you so much. It's been really nice meeting you.